I'd like to introduce you to Dr. Richard Satur, the CEO and one of the founders of DClinic. DClinic is an established medical blockchain consultancy that's launching a VIC Rewards Token. This token is an intrinsic part of their business, and Panxora is the lead investor in seed funding for VIC Rewards. Richard?
Thank you, Marcy. So, hello everyone. I'm talking to you from Brisbane in Australia, and I'm going to start off with a big bang statement. It always starts well with a big bang statement. So the first thing I'm going to say to you is that, and I don't think I'm going to surprise any of you, okay? But governments and healthcare organizations will go bankrupt, if they keep funding healthcare systems at the current and predicted future rates of spend. It's just not sustainable. And here's the thing, it's our taxes. We pay for that. So this is a real cost to us as taxpayers. So if it's not sustainable, then how do we solve this problem? It's a very big problem, but how do we solve it? And in fact, COVID has accelerated this reality for all of us, especially for governments. Now, my background, very quickly, I am the CEO of DClinic and VIC Rewards, and I have over 20 years in health tech, and I particularly have a PhD in artificial intelligence and big data mining. But our company has an amazing team of experts, huge team of experts, about 90 people globally. And this is including in clinical modeling, clinical standards, healthcare systems, integration, blockchain, and loyalty programs. In fact, we've been developing solutions for governments and organizations and health tech clients for well over 20 years. In fact, some of my staff have been developing over 30 and 40 years. Now, this is really important because the point I'm trying to make here is we intrinsically understand this sector. We understand the pressures that this sector actually has. In fact, many of our experts are actually well known globally and advocates and advisors for global change in the healthcare system. Okay, so what does our experience tell us? What do we know about healthcare? Well, I'm going to let you in on the solution. If we are going to solve healthcare, then we need to solve it with both technology and adoption. This is very important. Technology and adoption. That's how you get sustainability. And in healthcare, sustainability means vitality. It's the same thing. So now that I've said that to you, that it's both technology and adoption, why are we a technology company then? Why are we not just adoption? Well, the news is that organizations and governments are not going to throw away their systems. They have spent billions of dollars to build and deploy these systems around the world. The thing is, these systems are generally siloed. They don't talk to each other. So what we have done is come up with a distributed ledger system that creates interoperability between these siloed systems. So our technology sits alongside existing technology, and that's a huge positive for health tech. But blockchain is not going to work if you're just going to repurpose financial blockchains. And typically that's what people do. They take financial blockchains and they repurpose it for healthcare. Healthcare is fractal, it's complex, it's big clinical data. So these financial blockchains are just not going to work. They're just not going to work. What you need is you need a dedicated private healthcare blockchain. And that's where we come into it, because that's what we have developed. Because our blockchain works on global clinical standards and most importantly, meets all the provenance, regulatory and consent regulations all around the world. So that's the technology bit. But what about the adoption? Well, the thing is, consumers need a reason or inducement to participate in their own healthcare. In fact, most of you that I'm talking to right now, you probably don't even value your healthcare in the sense that you don't think of your healthcare like you think of your bank account. Well, why not? Why are you not thinking of it? It is as valuable as your bank account. What we try to do is we try to drive healthy habits. We try to drive healthy thinking, and we do that through VIC Rewards, which is a DeFi-enabled loyalty program that will operate initially on the Ethereum network so that it does does leverage the DeFi protocol. So that's really important because that's the adoption part. In fact, our goal is that VIC is already successfully advancing to becoming the default healthcare Bitcoin. And that's what we want. So our solution then, once again, is technology, which is blockchain, and adoption, which is loyalty. That drives sustainability. And so we think that healthcare is the most perfect use case for blockchain. And we think consumer vitality rewards is the most perfect application for utility tokenization. And remember, all of you are only patients moments in time. Otherwise, you are consumers of healthcare your entire lives. So how do we merge these two together? How do we get this healthcare data and this loyalty program to work together? And we do that through smart contracts. And that's the bridge. The bridge, which is smart contracts, brings together both this private data and this public data. So private in healthcare, public in loyalty. And it brings it together. And we can even deploy things like AI around this to even make these smart contracts even more smart. Now, the good news, how do we know we're winning? How do we know that VIC is taking control over here? Well, recently, we did a huge partnership announcement, which has gone global around the world. In fact, you can search it and find it very easily with XL Trip. And now XL Trip and our own marketplace are bringing together 2.5 million hotels, 500,000 global flights, 200,000 products, and we already have 30 plus wellness merchants, and we expect to have over 500 wellness merchants in 2021 offering vitality packages. And the reason we've done this is once you have your VIC, what do you do with it? What do you use it on? So we've gone the whole model. Not only do we promote the VIC, but we also give you an opportunity to actually use it. And one of the most lucrative markets is the billion-dollar medical tourism market that we are working with in Singapore, Indonesia, etc. Okay, so it's a big agenda. It's a monstrously big agenda what we're trying to do. So how do we know that this is going to work? Well, the huge advantage that we have is we're an established business. We are already doing business. In fact, our partners include not just Panxora, but also Deloitte Southeast Asia, by example. So we have big partners, and we also are winning contracts to establish our blockchain and our loyalty program in a number of projects, mostly in the ASEAN region at the moment, but slowly branching off into the ASEAN region, the EU region, and also US. And
30
the thing
seconds.
is, thank you. And the thing is that we know, if you just look at COVID, for example, most recently, is that if we can accelerate what they call warp speed, these products through blockchain and loyalty, we know we don't need to cut corners. We know that this technology can bring an amazing amount of sustainability. So 750,000 followers already. The answer, technology, blockchain, adoption, loyalty. That is what is going to drive sustainability. Thank you.
Thank you, Richard. Now we have a couple of minutes for questions. Okay. Okay, Richard, someone from the audience would like to find out, what is it about the VIC token that will get people to sign up for it? And then there's a follow-on question. Who will you be targeting as users for the token?
So that's where the listing comes into it. So our model requires consumer adoption, right? We want consumers to have skin in the game, all right? We want them to buy this token and profit from their own healthcare. So the purpose of the listing is to drive more consumer availability, more consumer awareness, and more consumer usage. But giving people VIC, allowing them to buy VIC, allowing them to earn VIC is only half the answer. They need to also spend the VIC. We need to create that ecosystem. And the way we do that is through our marketplaces, both the VIC marketplace and our partners, for example, like Excel Trip. So we create the value so that these tokens actually have true utility value. So I hope that answers that question.
Okay, one more question. Can you talk a little bit about the expected number of users and geographic growth?
Yeah, okay, so at the moment, VIC Rewards has over 200,000 community members. That's across all of our social media. And if you have a look at our videos, for example, we get huge numbers of hits. What this tells us is people want their healthcare to be valuable. They want to earn from their healthcare. They want to profit from their healthcare. So that's the first thing that's coming back to us. Now, the more partnerships we do, especially in the marketplace, where we can drive real value for not just the VIC, but also other tradable healthcare tokens, the more partnerships we do, the more people we bring. So if we just take VIC Rewards and we take Excel Trip, our premium marketplace partner, that together comes to 750,000 people. Now, we see that by next year that we're going to be in the 1 to 2 to 3 million users. So a very substantial group or community of followers. And again, why? Why do they want to do this? Well, because they want to earn from their healthcare. And why not? We should all be earning from our healthcare. And I'll add one more thing. Why aren't we using our healthcare for things like insurances, things like loans, things like a true DeFi elements, like things like medical device leases and so forth? So I think this consumer market is just going to grow and grow, and the listing is going to drive a lot of that adoption.